Well, let me start by saying Cancer Care Ontario and Melissa and I in particular are honoured to be the first in your series of speakers. So I hope that everyone will enjoy this, and we're absolutely open to having questions and discussion as we go through the presentation. And so I will get started. So I thought I would start by just giving you a little bit of information. Make sure I get the right one here. No. There we go. Just to talk a little bit about what Cancer Care Ontario is. So Kevin's given you a little bit of background about what we do. But we are the provincial agency responsible for continually improving cancer services in Ontario. And our vision is working together to create the best cancer system in the world. And our mission statement is that we will improve the performance of the cancer system by driving quality, accountability, and innovation in all cancer-related services. So as Kevin has said, we have developed a cancer plan, and I brought a couple of copies of the cancer plan which I will leave. This is our most recent cancer plan, and it spans 2011 to 2015. So we direct and oversee the spending of healthcare dollars as it relates to cancer. We do a lot of contracting with hospitals. We have contracts with over 80 hospitals in the province to provide cancer services, ranging from cancer surgery to the delivery of colonoscopy services, funding for drugs, and a variety of different things that touch cancer care. There are 14 cancer centers in the province, regional cancer centers, and so we relate to those cancer centers. There's a regional vice president in each centers, and that's the person that I work with closely on the accountability, on being accountable for the delivery of cancer services. So it's quite a well-organized system, and for the most part works quite well. And I'm not going to read everything that's on the slides. So this is our depiction of the cancer journey, and so starting with prevention and screening. And we're really increasing our work in the area of prevention at the moment. Screening and diagnosis have always been big areas of foci for Cancer Care Ontario. Treatment and then going on to either recovery and palliative or end-of-life care. So this is the cancer plan, and so our cancer plan came into effect on April 1st of this year. And as I said, it's a 4-year cancer plan. And we tried to develop the cancer plan in a very collaborative way. So we actually took about a year to develop the cancer plan. And we went out and traveled across the province and listened to a variety of different people, including providers of cancer care, the hospitals, CEOs, and we did talk well to a number of patient groups through either our regional cancer programs or provincially led groups of patients. To do with this cancer plan is make it much more patient focused. That was a real goal for us in the plan, and in fact the patient experience is something that I think is a thread throughout the entire cancer plan. And in fact we now have a director responsible for patient experience, and she's here in the room, Laura. And so you will see if you read the plan that is a thread throughout the plan. So in terms of the priorities, I'm going to focus on 2 of our priorities, numbers 3 and 4. Strategic priority 3 is to continue to improve patient outcomes through accessible, safe, high-quality care. And some of the initiatives that fall under that particular priority include our work in diagnostic assessment programs, disease pathway management, synoptic reporting, diagnostic assessment program, the electronic pathway solution, which we will spend a bit of time on today. And then the 4th strategic priority is to continue to assess and improve the patient experience. So that's the prominence of this through the plan. It is a priority unto itself. And what we're trying to do is provide tools for patients and for families as well to have greater control over their own care and navigate cancer system, assess and communicate their symptoms. And we have a number of initiatives underway that relate to that. So I'll focus now on the diagnostic phase of the cancer journey and diagnostic assessment programs in general. So one of the things that Cancer Care Ontario does is try to build programs that are based on evidence, and we have what we call the program and evidence-based care. And what they do is they will go through all of the evidence as it relates to a particular topic and come up with the best evidence which will guide how we're going to do certain things. So for example, there's evidence around the delivery of thoracic cancer surgery, and we have used that evidence to go from having 53 hospitals in the province doing thoracic cancer surgery down to only 13 hospitals in the province doing that. And that's because there's an outcome relationship with the number of cancer surgeries that you do in this very complex area. So, you know, it's taken us a couple of years to get from 53 down to 13, but we're now confident that almost 100% of cancer surgeries in the province are being done that way. So that's just an example of how we use that evidence to guide what we do. In the area of diagnostic assessment, there's not a huge amount of, you know, good scientific evidence out there about wait times for diagnosis and about diagnostic assessment in general. So what we have developed is a set of guidelines that are based on expert consensus and on the existing evidence. And what we have said to the 14 regional cancer programs is that you need to build diagnostic assessment programs that are based on these principles. And they include things like having a single point of access for patients and for physicians referring into diagnostic assessment programs, having the ability to have navigation for patients, and a variety of other things. So this, what this diagram depicts is the, you know, all of the sort of complexity around diagnostic assessment. There are specialists involved, primary care physicians and nurse practitioners. People might end up with the suspicion of cancer coming through an emergency department or a walk-in clinic. And so from those three streams can feed into a diagnostic assessment program. And what a diagnostic assessment program then should do is provide consultation, navigation, as I mentioned, access to diagnostic tests, psychosocial support, and then ultimately getting to first treatment. And what we've tried to do with diagnostic assessment programs is make sure that all of the care and support is received in a central location, hopefully to alleviate some of the stress and anxiety of going through a cancer diagnosis. We had an extensive session, I guess it's about 2 years ago now, where the Cancer Quality Council of Ontario brought together patients and providers and tried to understand what about the patient experience was causing anxiety and stress. And clearly the diagnostic phase is one of the most stressful because often there are multiple tests. I actually have a friend whose mother is going through potentially a lung cancer diagnosis at the moment, and she has not been referred to a diagnostic assessment program, and she has appointments that are all over the map. She lives in Barrie. She's going to Lakeridge to Newmarket to have some of the testing done, some of it being done in Barrie, and she's 82, and it's not the ideal way to get that done. So what our diagnostic assessment programs are attempting to do is to bring all of those things together in one place so that you have one person that you can talk to get your questions answered, get as many of the tests done at the same time as possible, and then have all of those results consolidated and communicated to you within that diagnostic assessment program. So I've probably said a lot of this. So the diagnostic assessment program, so our program within CCO, which Melissa is the manager and basically does all the work for, is kind of an overarching initiative that is working to try and improve that diagnostic phase of the cancer journey for patients and also for clinicians. I mean, one of the things that we heard in that session that we had a couple of years ago was from primary care providers. And once you get into the cancer system, once you're into University Health Network or the hospital in London or wherever it is, and you're getting your cancer treatment, things tend to go pretty smoothly. But it's getting to that point that is complicated. And when primary care providers refer patients into cancer centers, what they said to us was that they didn't know what happened to them until they kind of got spat out at the other end, and those family doctors had to manage perhaps complex ramifications of either chemotherapy or radiation or surgery, and didn't have the information of what the patient had gone through throughout the entire journey. So some of our goals in our diagnostic assessment program, there are three basic objectives for what we're trying to accomplish. We are trying to decrease the time from suspicion to diagnosis or resolution, and to improve the patient outcomes where possible. So we're focusing initially on lung and colorectal cancer. And I mean, one of the hypotheses that we have is that if we are able to diagnose lung cancers earlier, that we may actually be able to improve the outcome. So if we can shorten the wait times to get your lung cancer diagnosis, we may be able to catch the cancer at a stage 2 instead of a stage 3, where you might be able to actually have the operation and in fact have a better outcome. So clearly it's going to take us a while to be able to prove that, but that's one of the possible outcomes of this. On the wait times piece, it's very complicated. CCO spends a lot of time measuring wait times. We measure how long it takes you to get from your decision have surgery to actually have the surgery. We measure how long it takes you from when you get referred into a cancer center till when you actually see a radiation or a medical oncologist. And we measure how long it takes you from that time until you get your chemotherapy or your radiation or your surgery or your colonoscopy or whatever. So we're pretty good at measuring wait times. We're not good at measuring diagnostic wait times. And in fact, we've done an extensive search, an environmental scan worldwide really, and nobody is doing a good job of measuring wait times. Ideally, we had a symposium where we brought together experts, and what people said to us was, well, we'd really like to be able to measure from actual suspicion. So suspicion is really hard to define, as I'm sure you can imagine, because it might, as somebody said, well, suspicion might be when you feel a breast lump in the shower. Well, clearly we're not going to be able to measure that because there's all kinds of factors that are going to come into play. You don't really want to go to the doctor. It takes you a while to get an appointment, all those sorts of things. So what we have done is kind of use a proxy for that, which will be when you get referred by your family doctor into the diagnostic assessment program. So that's going to be our starting point, because again, the hypothesis is once you get into that diagnostic assessment program, which is a defined entity, we will be able to speed up all of the things that need to happen to get your diagnosis or your resolution in place. So that's where we're going to start. It's not perfect, but it's a starting point, and it's certainly better than anything that we have at this point in time. The second objective is to optimize the experience. So this is to try and relieve some of the anxiety and the stress that's caused by not knowing whether or not you have cancer. And then the third objective is to optimize satisfaction and experience among primary care providers and specialists. So this is the part that the family doctor refers their patient into the diagnostic assessment program, but they will be able to access information through our electronic pathway solution about where is the patient on that pathway, what are the test results, does this patient indeed have cancer, and other the other things that go along with that. We have established at Cancer Care Ontario a patient and family advisory group, which is led by our head of nursing for the province, who's Esther Green, who is also here. And so that's a relatively new thing for us. And I think one of the things that CCO is really trying to do is increase that involvement of patients and families in a lot of the work that we're doing. So it's a relatively new undertaking for us to really more actively engage patients and families in our work. Now, I talk fast, so if you do have any questions, just please let me. I do have a tendency to talk a little bit fast. So please jump in if you have questions. So diagnostic assessment programs. They sit in our regional cancer programs, and our regional vice presidents are responsible for implementing diagnostic assessment programs, for reporting to us on progress, and we will be starting to report these wait times as of December of this year. So that's been a huge amount of work to get to that point. And that will be measuring, as I mentioned, that referral to well, there's a number of pieces in that wait time, but until there's either resolution or positive pathology will be the end point if there is a cancer diagnosis. They are designed to improve the experience of patients with suspected cancer as they go through the process. They're made up of multidisciplinary healthcare teams that manage and coordinate diagnostic care from testing to definitive diagnosis. And they're designed to improve patients' access to healthcare, obviously, and designed to help patients self-advocate. Offer patients centralized access to care, a patient-centered environment, coordinated services, they can access a timely diagnosis and support information. And that's a really important piece in terms of accessing information. That's one of the things that people tell us is they just don't have enough information, and it's difficult to access. We currently have DAPs at 14 regional cancer centers across the province, and they are in existence now for lung, breast, colorectal, and prostate cancer. The two that we're focusing on and providing funding for at the moment are lung and colorectal. There are a number, through our Ontario Breast Screening Program, a number of breast assessment centers and rapid breast diagnostic centers. And so that's not coming directly out of sort of our piece of CCO, that's coming out of our prevention and screening portfolio. So key roles. So these are the people who are involved in diagnostic assessment programs, and these are real people. So we have a regional vice president, and that regional vice president leads the cancer program. And the regional vice presidents are housed in the cancer centers. So for example, Princess Margaret is a cancer center. We have a regional vice president there. But they are also responsible to bring together all of the other people in the vicinity, in the LHIN, for the most part, who provide cancer services. So in Toronto Central, for example, PMH is the cancer center, but they bring together St. Mike's, Mount Sinai, Women's College, and others, and community providers on the provision of cancer services for people who live in this area. Okay, so that's their responsibility. The DAP manager, so we have managers in each of those diagnostic assessment programs, and they're responsible for, obviously, for the day-to-day management of the DAPs, and they work closely with the RVP and with the navigator, and also with us. Patient navigator. The patient navigators are really, really key, and most of our patient navigators are nurses, and I think I guess from my perspective, it's probably the most important role, because they are the person who is there to answer questions for that patient. They are the key point of contact for the patient and for their family. And basically can make sure that the patient is getting the right tests, that the patient is getting things done in a timely manner, that the patient and family are getting the information they need, and basically answering their questions. And then in terms of administrators, those are often the first point of contact for patients. So that might be the clerk in the diagnostic assessment clinic. They will coordinate referrals, be perhaps the key liaison with the primary care office, and also obviously deal directly with patients and their families. So just to talk a little bit about some of the research that's associated with this, and some of the things that we've been told in terms of that patient journey. So this is a satisfaction tool that we use, and so we use this for patients who have gone through their care, so they've had their chemo or their radiation. And Esther will correct me if I say anything wrong here. And so it's called the Ambulatory Oncology Patient Survey, and so we assess a number of things on this survey. The least of which is emotional support. We tend to score, the cancer centers tend to score very well on the majority of questions. But where we tend to always fall short, and this has been consistent over the last, there's 4 years of data here, in the area of emotional support. And so when we started thinking about diagnostic assessment programs and decided that one of the things that we wanted to do was to build an electronic tool to support both patients and providers through the diagnostic process, we wanted to understand this a little bit better. So in 2009, we actually commissioned some research and wanted to delve a little bit further into this emotional support question. And so we worked actually with a researcher here at Princess Margaret and surveyed a number of patients who had gone through a cancer diagnosis and in either lung or colorectal cancer. And so 175 patients were surveyed, 94 of those were lung cancer patients and 82 were colorectal patients. And we asked them about their diagnostic journey through a survey. And I mean, basically what we found, we did quite extensive work on this piece, but basically overall, information needs were identified as being the most important need for both lung and colorectal cancer patients. They identified emotional needs as obvious, as also very important. And they identified certain points along the diagnostic journey where that was sort of more stressful. So it might be when a test result came out and they needed help in understanding what did that test result mean. So those were the things that sort of caused peaks in anxiety and stress. They reported that in most cases their needs were met, but that they indicated that they needed more sources of information. Yes, you have a question?
To me, that chart suggests that something happened between 2006 and 2007. Is that just an artifact, or is that under emotional support? It looks like there's a big drop there.
Well, that's a good question. I don't know, Esther, do you? It's a good thing you're here.
Say that in some centers we have with psychosocial oncology programs and others, they may be still getting off the ground. You know, your point's a good one. How come it was about 55%, but
Yeah.
down 50%? It could also be the number of patients that have responded to the survey, which has gone up. Was it gone up a little bit?
Yeah.
It's a number of areas.
It could be within the confidence interval.
Yeah.
It's possible, yeah. And then one of the other things that we did in this survey was actually look to see where people were going for information. And I mean, clearly the internet was, it is increasingly becoming where people are going for information. It was interesting because we're doing much of this work with the Canadian Cancer Society, and there were not a lot of people going to the Canadian Cancer Society's site to look for information, which we found to be quite an interesting finding from this work. So anyway, so that these are all important for us as we have built this this electronic pathway solution. So finally, I'll get to the electronic pathway solution. But I think it's important to sort of understand how our thinking has kind of evolved on diagnostic assessment programs, and that thinking has helped us to start to build a tool that we think has huge potential to have a significant impact on that diagnostic journey. And ultimately, if we're successful with this tool with the diagnostic phase of the journey, it's something that can be used throughout cancer treatment, out into survivorship, palliative care, or other parts of the cancer journey. So we have built this electronic pathway solution. So this is a joint initiative between Cancer Care Ontario and the Canadian Cancer Society, and they have been a very strong partner for us in this work, and in fact have funded essentially the first phase of this work. So we have developed an electronic pathway solution, and it's intended to facilitate all of those things that I talked about. So it's intended to make sure that people have the right information, that there are links to, primarily to the Canadian Cancer Society, and they have a wealth of information available. They have people that you can phone who are there, at all hours to ask questions. They put patients together in discussion groups and have really a huge amount of information that can be mined for this purpose. So as I mentioned earlier, we're focusing on lung and colorectal diagnostic assessment programs. And the reason for that is, well, first of all, they're very common cancers, as I'm sure you know. And second of all, that we have work going on at Cancer Care Ontario on developing disease pathway management, essentially. And so what that group has done is construct the pathway for what should happen to get a diagnosis of either lung or colorectal cancer. So it lays out very clearly the steps. So if you have a persistent cough and you've had a chest X-ray and blah blah blah, and then it goes through all of the various steps that you need to go through to actually decide, does this person have lung cancer or not. So that is the basis upon which our diagnostic assessment programs are built. And those pathways do a number of things. We feel very strongly that patients need to be able to see those pathways, because that helps us to hold people accountable for, am I getting the right tests? Has something been missed? And so patients can actually go and they can see these are all the steps that need to take place, but I didn't have this or whatever. It also helps us in terms of how healthcare services are utilized in the province. Are tests being repeated unnecessarily? I mean, sometimes what happens is that a CT scan that's done in a small rural hospital, for example, and then the patient comes to a large academic hospital, I won't name any, you know, sometimes they say, I need to do this again because I don't like the way it was done or whatever. And, you know, most of the time that's really not necessary. So it will help us in terms of the utilization of services, which is a system benefit from our tool. So based on those pathways, which we have now in place for lung and colorectal cancers, and we've brought together experts, and those experts include family doctors, nurse practitioners, if in the case of lung cancer, respirologists, thoracic surgeons, and really all the experts, and have looked at the evidence to build those pathways using the best possible evidence and expert consensus. So we have 2 pilot projects underway at the moment with our electronic pathway solution, one in Thunder Bay and one at Grand River Hospital in Waterloo. And so we launched the pilot in May, and it will run until the end of October. And we have, the tool is still very much under development. So what we've done is we've rolled out the tool in waves, essentially. So we roll something out, and then we get feedback from the people who are using it, and then we, you know, add the next feature. That's the word. Thank you. The next feature that people would like to see in the tool. So we have a lot of goals for what this will include. Everything's not there yet, and Melissa's going to do a demonstration of the tool for you so that you can see what is there. But you know, Kevin, when he did his introduction, talked about the need to see results, and you know, we feel very strongly that that is absolutely one of the key things this tool needs to be able to deliver. Is, you know, you've had a chest X-ray. What were the results? So we're not there yet. That's in phase 2 of the tool. It's a very complicated thing to do, and we need to link to a whole bunch of other data across the province. But we have very clear plans in place for what the tool will be able to deliver in the next phase. We've had lots of very feedback about what it's doing now, and you'll see that. So I won't tell you that because I'll say everything Melissa was going to say. So are we there? No, we're not there. We're keeping you on the edge of your seats. So there are 2 portals in the tool. One is for providers, and one is for patients. It's an interactive tool built on clinically validated disease pathways, as I said, and it's designed to empower patients as they progress through their diagnostic journey. The benefits to patients: access to fast and accurate information, provides you with a snapshot and timeline of where you are in that diagnostic journey. Patients can invite family and friends to follow their progress online. That's a patient's decision to do that, and so therefore family and friends in terms of their diagnostic journey. They can see their entire care team. So there's a list and the contact information for all of the people who are on that care team. And one of the things that we will be doing in the second phase of this is the ability to electronically communicate with those members of your care team and get information back from them as well. For clinicians, it gives clinicians access to evidence-based pathways to help them determine the best approach to treating a patient. I mean, often family doctors aren't sure. Should I refer this patient now, or should I wait? Should I do more testing? And this will help them to make those decisions. It streamlines and coordinates diagnostic scheduling and testing, will give clinicians access to important patient information when they need it, and will support physicians in identifying when a patient should be referred. In terms of the system, I think I've really talked about all of this: reducing duplication and waste, coordinating activity. I mean, the measuring wait times piece is really an important piece for us, because while we may not have the perfect start point that everybody wants, at least we will be able to measure a portion of that, and we can see where those wait times are coming down and what people are doing to enable those wait times to come down. Yes?
On the previous 2 slides, you showed what the providers get and what the
went too far.
patients
Yep.
get, and there's what looks like on the surface looks like a bunch of technical information that the providers get that the patients don't get. So my question is, what's the decision on what information the patient compared to information the providers? What's the basis?
There is no difference.
There's no difference.
Nope. You can see the same information. It's your information, right? I mean, it's the patient's information. another of my little personal anecdotes. My neighbor, his mother was being diagnosed with cancer, not in Toronto, in another city, and they were having a bit of a rough go. And I said to him, ask to see her chart. Well, he had no idea that he could do that. And I made, it's your information. It's not owned by the hospital or owned by the physician. You can get your information and you can see it. And frankly, the hospital made it incredibly difficult for them to get the chart, but they did eventually get it. You got to pay for the photocopying, and but that's personal. I think that bugs me, frankly, because it is your information. So how does it empower patients? I don't think I need to read all of this. I think we've really talked about this. I do want. Oops, sorry. Wrong way. I do want to emphasize this: the medical encyclopedia that the Canadian Cancer Society provides, because it is really very good information. It's accurate information. It's been vetted by professionals, so it's good information, because you can go on the internet and you can find all kinds of things, and you don't know what you're getting, the quality of what you're getting necessarily. So now I'm going to turn it over to Melissa.
What we're going to look at first to start off with is the patient portal. Judy had described there are two portals for the DAP-EPS, which is what I call, to abbreviate, the Diagnostic Assessment Program Electronic Pathway Solution. It's quite a mouthful, so I call it the DAP-EPS because I say it many times a day. And so I'm going to walk through the patient portal to start off with, and then we'll do a quick overview of the provider portal, because I want to demonstrate that absolutely the content on both portals is the same. So this is the login screen for the patient portal. We're going to log in as a patient. Oops. So Indiana Jones is coming in for a lung cancer diagnosis. And the first page that you see when you log in is what we call the patient dashboard. Well, all of the portals will have a dashboard. Depending on who you're logging in as, the dashboard will change based on your profile, but the information that's shared within the two portals are the same. On the upper left-hand corner, what you see first is the patient news flash, and there you're able to see a quick overview of the patient information that is most relevant to you. So it reminds you to check your appointment calendar for further details, but just as an update, it tells you that you have an upcoming appointment for a consult procedure, and that's scheduled on October 7th at 8:30 a.m. at Thunder Bay Regional Health Sciences Center. And that this was last changed on October 3rd. As well, it tells you that there are results that have been updated, and that results are now available for blood work that was done, and that was done on September 29th, and those results are available. It also reminds you that if these results, if you do not have a scheduled appointment to review these results already, to call your specialist to schedule one, but otherwise it reminds them that this is what the next steps are for them. The third portion of the patient news flash is letting them know about their diagnosis. Indiana is still undergoing diagnosis right now, and so the diagnosis has not been updated, but when it has been, it'll indicate on the patient news flash that there is a diagnosis available. On the upper left-hand side here is the information regarding the diagnostic center, upper right-hand side is information regarding the diagnostic center that Mr. Jones is being seen at. So he's being seen at the Thunder Bay Regional Health Sciences Center, and there's some useful links which are associated with that center there. Such as location, parking information, the layout as well. And then there's also some further useful documentation. So there is, for Mr. Jones, he might want to see again the lung DAP patient introduction letter, which is what he would receive upon entry into the DAP. Further down, we can see the patient's care team. All of this content on the dashboard, I should also say, is available within the body of the portal as well. So on further tabs, you can see more information on this. But the idea of the dashboard is that everything's available easily as the patient as soon as they log into the portal. So this is a quick overview of the patient's care team. And this is really all the physicians who are involved in that patient's care, as well as any family or friends that patient may have chosen to add into their care team as well. So we can see that he has appointments with Dr. Gaiman and Dr. Chan, and the appointment type associated with them, as well as phone numbers should they need to reach them. And as well as Grace Jones, who's been added as a family or friend member, and the referring physician as well as Dr. Gaiman. And on the last tab, we can see the family physician that is also part of this patient's care team. And this is to ensure that all the physicians who are part of the care team and all the family and friend members that are part of the care team, they're also able to log in through the provider portal or through the patient portal if they're family and friend, and see the same set of information that the patient and all the providers are seeing. The ideas of this tool is really to help improve collaboration and sharing of information amongst all the individuals who are part of that patient's care. So if we look further down here, actually we'll move, I'll just take you through the appointments after. On the patient profile, you can see, sorry, I should also say that the information that's provided within the tool is primarily read-only on the patient side. If there is a need for them to update the content within the patient side, that they are able to notify the DAP to update, and that's what it says right up here. So this is the basic personal information of the patient. And further down below, we can see some of the medical history, the medications, and the family medical history with that patient. Right now, the DAPs are adding this information in, so we can see that Mr. Jones is allergic to aspirin, he has diabetes, he's taking insulin for his diabetes, and he's also on Nexium for stomach pain. And as well, any family medical history, there's his paternal uncle has a history of heart disease, and his mother's in remission from breast cancer. If we wanted to see any more details regarding any of these features, this opens up a window within the tool, and we can see that the same information as well as any notes that have been added on. So we can see here that his uncle also had a heart attack and had triple bypass surgery. So they're able to add in any information which may be relevant and helpful for the providers to have a good grasp of. Yes?
And why is it important to not let the patient update their own information?
So it is, yes. I mean, we talked a lot about this. There may be an opportunity for us to do that. For the pilot's purpose, we felt that it was important that there was a single source of truth, and that it would be stemming from the DAP program to start off with. There may be an opportunity, I know, for us to move in the direction where patients are able to edit their own information, particularly this profile information. But one of the things that we are also working on is integration with hospital electronic medical records. Sorry, not hospital, but physicians' electronic medical records, or EMRs. So some of this information would carry over as well. And we just want to be sure that the information is consistent throughout the patient profile.
I mean, if I pick up the phone and I call the office and I say my address has changed,
Yeah.
they're just going to type it in just like I would probably,
Yeah,
right?
absolutely. Yeah, I agree with you.
It will come in the next phase of this, and I mean, you have to remember that this is our first build of this, and and that's the kind of feedback that we're getting from people, is exactly that kind of thing, which is to say, you know what, we should be able to update this ourselves, and
I understand the practical issues. I just wondered if there was a philosophical.
No.
Technology.
Yeah.
Our CIO is controlling his office.
So if we look further at the appointments for for Mr. Jones here, we can see there's two different views that we can see the patient's appointments, either in list view or a calendar view. The calendar view is like so, and describes shows you where the current date is and any upcoming appointments. My preference is always for the list view personally. We can see all visits here. and this patient has had, and so this shows you all the diagnostic tests that this patient has had as part of the DAP program or prior to entry into the DAP program, which is relevant to this diagnosis. And we can see here that they've had a pulmonary function test on September 12th at 11 a.m. and that the results are available. So if these results have not yet been reviewed with them, the patient knows the results are available and to ask about it the next time they see their doctor. As Judy mentioned, for phase 2, our goal is to have the results actually available within the tool so that you can see that it's available, click on it, and your results will be there. Same goes for the blood work. Here we can see that they had a chest CT on September 30th. The results are not in yet. And then as we saw on the dashboard, they have a consult coming up. If we click on the consult appointments, we can see more information about the appointment. So it's scheduled for this Friday at 8:30 a.m. They have a consult with Dr. Kenneth Gaiman at the Thunder Bay Regional Health Sciences Center. There are no results yet, obviously, because it hasn't happened yet. And here's where some of the content that's coming in from the Canadian Cancer Society. There's a description of the procedure, in this case it would be a consult, and there's a few lines describing what the consult is, and when we click on this it opens up more and further information, another window of content that's coming in from the Canadian Cancer Society's medical encyclopedia, further describing the consult. So this is available for all the different types of tests that exists, including chest x-ray, CT, blood work, and if they click on that, they're able to find more information. Some of it's just text, some of it includes pictures and video, and it's really rich information that has been clinically validated to provide to the patient. And it's all embedded within the tool. The idea is that we didn't want patients click on something, open to another window, click on something, open to another window. You know, we recognize that the patient group may not be very computer savvy and we don't want them to get lost within the tool. So everything with all the information with the tool is primarily embedded within the tool. So you open up a pop-up window and close it, you're still there. So you know where you are always. Here is a list of all the results that are available within the tool. Or sorry, that's the results that are not available within the tool, the results that are now available, but will be available after phase 2. And here are the diagnostic pathways that Judy mentioned. So this is work that's been developed by the Disease Pathway Management Group here. As we can see, this patient is undergoing diagnosis right now, so it's automatically flips to the diagnostic procedures portion of the pathway. If we scroll down, we can see here the font's quite small, this pathway that's being presented within the tool is meant to be targeted for clinicians primarily at this time. It is our goal for phase 2 to have patient-friendly pathways sharing the same information but make it a little bit more understandable for some patients. Some of the language that's used in the clinical version is not very clear, and we would also like to make it clickable so that some of the terms which may not be clear, that there's content to go with it so that they have a better understanding of where the patient is on the pathway and what's associated with it.
Melissa, if I could just make a comment about this. I mean, this was something we struggled with a bit in terms of whether or not to put this on. I mean, we felt strongly that even though it is quite technical, that it was important that that patients and families could look at this information and use it to ask questions and to trigger questions maybe more than anything else. So there was some concern in our pilot sites about the fact that it was too technical and that it would be overwhelming for patients. We haven't really had that feedback from patients. It seems like people like the idea that it's there, so it's it's a bit of a work in progress, but we felt very strongly that it was important to have it there.
Yeah.
I'd be interested in people's thoughts on that because as it's bronchoscopy and needle biopsy and what is that may not mean much to people.
I mean, I'll tell you what I think.
Sure, please do.
I would much rather have more information, too much information, rather than too little information.
Yeah.
I can always ask somebody, hey, what's this mean?
Exactly.
But I don't know what I don't know if it's not
Exactly.
there. Right?
Yeah.
Yeah.
So I mean that was our feeling about it as well. I mean we did get a bit of pushback on that, but and we said that some of the concern was that it would cause more anxiety because you saw all this, and it's complicated. I mean, the pathways are complicated, and it might cause more anxiety. And so we agreed that if that was the case, we would revisit that. But we haven't really had that feedback. So
We haven't. Yeah, it's all been very positive and well received. This is the first time that these pathways are being shared with the public. They are going to be shared more publicly as well in the coming months on the Cancer Care Ontario website, but right now this is actually the first time that they're available to the public. So it was a bit of a challenge, and there's a lot of discussion associated with this to be sure that we weren't provoking anxiety, and that patients weren't going to go to their physicians saying, why didn't I get this test? I'm not too sure. But the reality is we want patients to ask these questions. These are the clinically validated pathways of what the patient's standard of care should be. And it's okay for patients to go back to their physicians and say, I noticed I didn't get this test done that's on the pathway. Why is that? And the physician, should be very comfortable being able to defend why. And not all the tests may be appropriate for that patient, It just depends. One person described it to me, it might be like a highway, right? So you may not get off on that exit because you don't need to. You just keep going ahead. So. And these are all questions, very important questions for patients to know and have the answers to. If we want to click further, if we want to see some staging, we can click on that and see further data on staging. If Mr. Jones is curious about what might come ahead, if perhaps his diagnosis was positive. There is one piece that I had forgotten to mention. On the Appointments tab, if you scroll further down, there is a health journal that patients are able to access. So what this is, if I click on it, this opens up a printable diary that the patient is able to use to capture some of their thoughts as they're going through the diagnostic journey. And it includes a little bit of guidance regarding why they should journal and tips for journaling. It's a means for them to keep track of questions they might have as they're going through to the different appointments that they have, and to share some of their thoughts. It's a very subtle form of psychosocial support, but there's been mixed reviews. Some patients have found that it's really helpful, and some say, I don't really need anything like this. But the option is there for them to have this as a tool available to them and some support to use that.
Sorry, and just back to the pathways for a second. That staging, but the staging, there's clearly a whole lot of other steps on that pathway which are actually still some of which are still being developed. And ultimately, if we can use this tool for the entire cancer journey, obviously that entire pathway would go up there. So it's just that some of them aren't actually finished yet. We really pushed to get the diagnostic phase done so that we could use it for this purpose. Sorry.
No problem. As I mentioned, so all the items on the dashboard can be found within the tool. Here's an expanded version of the care team. You saw that I was clicking through page by page on the dashboard, and it's just because it only shows 3 rows. But if you want to see an expanded view of your full care team, you can see it here on this page. And it also functions as a bit of like a phone book for the patient, so that they know, these are the providers that I have this appointment for. This is where I can, contact them if I need to. And this is the appointment that's associated with them. One thing that is always a problem for patients who have multiple appointments is they can't remember which doctor is with which appointments and, how to reach them. And so they're busy juggling a lot of the things on their own, but this is all available within the tool for them. As well, on the care team is a link here to allow them to invite a family or friend member to follow along their diagnostic journey. It's important here that that the patients have an understanding that the same information that the patient is seeing is the information that their family or friend member that they choose to add will see. Early feedback that we got from this feature was very positive. One of the daughters of a patient, had mentioned that it was really helpful to have this as a tool because she was able to see, she lived far away from her mom, and she was able to see, what was coming up for her mother during her, as she was going through in the different diagnostic tests that she had. And the last tab that we have here is the Diagnosis and Information tab. So we can see here again the Diagnostic Center information, and we can see here that the diagnosis is in progress. I'm going to show you on the provider portal how it will look on the provider side and what triggers a change on the patient's diagnosis portal as well. This page itself is not as rich in content as we would like it to be at this time. You know, we have a real opportunity to tell patients something important at the time of diagnosis, be it positive or negative. You know, what's going to happen next? What are the next steps? You know, if you have a negative diagnosis, you're going back to your family doctor. You know, what's screening going to look like? What, you know, other follow-up needed. If it is a positive diagnosis, what support is available for you? Who are, you know, what are the next steps that you're going to be engaged? So this is definitely, you know, one of the pages within the tool that we're continuing to develop. And we know it's an ongoing process, and we're working closely with the Canadian Cancer Society to make sure that this content is as rich as possible and covers off a lot that they're getting from their end as well. The help tab is just technical questions primarily. So if there aren't any additional questions regarding the patient portal, I'll give a, oh yes.
Could you tell us a little bit about the integration of this portal with other patient portals? So your two pilots, I don't think either of them have patient portals at this point in time, although there's the Healthy Connect program in Waterloo Wellington, which I think has a patient portal
Yep.
component to it, but I don't think there's one, or I'm not aware of one in the Northwest. But could you speak to, but I'm thinking about other organizations like Sunnybrook.
Yep.
And their patient electronic health record. Could you tell us a little bit about the integration to date and what your plans are in terms of, so that patients have one-stop shopping?
Sure. Yeah. I mean, for the phase 2, we're definitely looking at integrating more with the provincial assets that are currently available, and that includes things like the Ontario Lab Information Systems and electronic medical records, and to help improve, you know, single sign-on. But I absolutely, you know, hear what you're saying about patient portals that already exist, and as we are starting on the road to province-wide rollouts, we invited regions to apply to be the next sites to adopt this tool. And Sunnybrook was one of the sites that said, we already have something very similar. I don't think this is going to really meet our needs. That, you know, we're covered off, I guess, not in a way that it doesn't meet their needs, but they're already covered off in this area. So at this time, you know, we haven't given much thought about how that's going to play with MyChart. There's always an opportunity for us to integrate in the moving forward, but at this time, we're working with regions which don't have any tools available for their patients. And, you know, Sunnybrook is very fortunate that they're able to leverage the tools that they have already in place. And we're actually learning a lot from them because they're one of the tools that is sharing some results with patients. And so we've taken an opportunity to learn from them as to how they've done it. There's a lot of questions which are involved in sharing results with patients, such as, you know, when do you share results? As soon as they come in, after the provider talks to the patients, after, you know, 5 days. If the provider hasn't talked to the patient, the results should become automatically available. What kind of educational support is there going to be to go with the results? So there's all kinds of things that we're thinking about, and Sunnybrook, MyChart system is definitely one that we were doing a bit of lessons learned from them to find out more.
Great. One other question, and this applies to both the patient side and the provider side. Could you tell us a little bit about the source of the data? So at Thunder Bay Regional, or the data flow. So are you pulling data directly out of their Meditech HIS?
Yes.
Okay, that's great. And similarly at
Grand Rivers, McKesson. Yeah. Yeah. Yes.
Can you speak a little bit of how you engage patients? So you talked about you're optimizing the patient experience.
Mm-hmm.
Alludes to a sort of a continuous quality improvement process. And you spoke a little bit about the advisory committee. Can you just speak to me about how patients are feeding into the development and the improvements on this?
Absolutely. So the process that we go through for development is very iterative. We put out a new release of the tool fairly regularly, especially during pilot. And we were able to get continuous feedback from the DAP staff who are using the tool, as well as the early patients who started using the tool. So as soon as the patients started using the tool, we were getting feedback as to, oh, it'd be nice if this was a little different here, and this would be, this was over here. And they tell the DAP staff, and that comes back to us as well. Another mechanism that we also have is a patient satisfaction survey, which is general for the diagnostic assessment program, but there's also an additional page of questions addressing the DAP EPS specifically, which allows the patient to comment a little bit more explicitly on the tool, as well as how they found the use and usability of the tool, and whether or not it was easy for them to find information, the functionality, and so forth. Another way that we receive patient feedback is through some of the research that we did with the Elixir research group that's here at PMH, and they did research with providers as well as with patients, and walked them through the tool and some of the features. And this is where I also got the feedback that some found the journal would be helpful, some found that it wouldn't be helpful to them. So those are 3 different streams that we'd get feedback from the patients.
And the other piece is that we have an extensive evaluation plan for this, and that will absolutely include input from patients and families.
Can you explain a little bit what that is in that evaluation?
Well, there's a variety of things in the evaluation. There's definitely patient satisfaction survey. We had wanted to build something, sort of a kind of point of care response in, so while you're using it, how something, if you're shopping online, for example, you get a thing to say, how was your experience? So, that's something we'd really like to build into this. We don't have that yet, but hopefully that's one of the things that we can do in phase 2. What else is in the evaluation?
We're looking
survey,
at, we're trying to work through getting focus groups together as well. It's been a bit of a challenge for a privacy perspective, but it is definitely something that our goal is to get focus groups put together to get feedback on the tool as well. And another thing that we're also working on is there is a living labs within UHN as well, and we're looking to have them test the tool with us with actual patients as they're clicking through the tool, how they're finding it, and whether or not they're going back and forth through the different pages. So there's a living labs research center here that will be able to feed back information to us as well.
So that's more effective on a usability standpoint.
Mm-hmm. Yeah. So just a quick walk through the provider's portal. I'm going to log in as a patient navigator. So the navigator's portal looks quite different when you log into their dashboard. You can see here immediately all the patients who are associated with that navigator who they're seeing at the diagnostic assessment program. They, as Judy mentioned, we are specifically looking at lung and colorectal cancer right now, so they can sort by the different disease types if they so choose. And further down here, they can see any messages that the provider may be sending to the DAP. And so, as Judy had also mentioned, our goal for phase 2 is to also allow patients to message the DAP as well. So if they did want to do things like update their address, they don't have to call. They can just send a little message and say, my address is changed to this, by the way, until we're able to let patients do that on their own. And the DAP staff are able to acknowledge by clicking off here that it's been dealt or resolved with, and who received it, and the date it was resolved. So if we look further about Mr. Jones here, go in and we can see his patient information. As I said, it's all the same as on the provider side as it is on the patient side. Only here on the provider side, you can edit the information available. So same medical history, medications, family medical history, the appointments. If we click on the referral into the DAP for this patient, we can see all the different diagnostic tests that they've been referred to. But what's also been done for this patient is that a template for the suggested test that this patient may also have has been loaded in as well. So there is a list of all potential tests that this patient may have, so it just makes it a little bit easier in terms of the workflow. So it also triggers a reminder for the navigator or provider to say, oh, yeah, do they need a PET scan? Oh, yes, we should book that right away. Or no, they don't need it, so they can edit or delete it if they so choose, as well as any tests that may be associated with staging.
So Melissa, would that go back to the,
Yes, absolutely.
so all of those elements that were in the, DM pathway?
Yeah.
Would be one for the provider to say, yep, we need to do that. So
Yeah.
that there's a real application.
Absolutely, yes. The results tab here, same as what's on the patient side. It's just a notification of that the results are available for phase 2. We'll have the actual results available, both provider and patient side. The diagnosis tab here allows them to edit in the information for that patient's diagnosis. So they're able to see here and enter in the information. So the date of diagnosis, and we're also able to enter in the date that the patient was notified. And so this field is bolded here to indicate that this is what's entering a date here is what triggers a change on the patient's portal. So if you enter in, perhaps the date that the diagnosis is not the same day that the patient's notified, we don't want the patient to necessarily find out through the tool that they have lung cancer. That would be very distressing. Ideally, the scenario would be that there is a healthcare provider who talks to the patient. And so we indicate here that there is a date that the patient has been notified of their diagnosis, and that triggers a change on the patient's portal. As well, if possible, there is a date of first treatment available, and the different options for the diagnosis, so positive, negative, inappropriate referral, or non-diagnostic, which is going to be changed to suspicious or follow-up. And that would happen in cases where the diagnostic assessment program has followed the patient to a certain point. The pathology results may be indeterminate. They need to follow up with the patient 3 to 6 months from now with another x-ray, another CT or biopsy. And so they would say that they're suspicious for follow-up, but we're going to close out this patient's referral into the DAP right now. And when they come back in 6 months, we'll reopen it. As well, we're also able to make notes to the provider here. I should also mention, actually, I forgot to show, on the appointment side, if we click on an appointment for the patient, it's coming up. This allows the provider, so the nurse navigator, if they want, to make notes to the patient to indicate, reminders. So if you don't, any instructions they might have, please arrive a little bit early. Fasting is needed for this test, and so forth. Here is a space for them to make a few notes on for themselves. I will also indicate here that there's a number of date fields which are optional at this time. And this allows the DAP staff, if they so choose, to enter in these dates if they wanted to track the wait times on their own, so that our focus is on the big waits between referral to diagnosis to first treatment. But for some of them, they're really worried about, is the CT clinic that I'm referring them to going to get them the first appointments? Is that going to be faster than if I referred them to the CT clinic within their own hospital? And so they may track, the request date and when the actual appointment date is amongst themselves, so that they can better understand where their bottlenecks are within the hospital. Yes?
The notification process that's built into this, is it kind of a one-size-fits-all process, or is it flexible? For example, like I'm a just the facts kind of guy, right?
Mm-hmm.
I don't care whether I get a phone call or I read it on here to get my diagnostic information, but it looks like, the tool imposes a particular order. Is that true, or am I just?
Yeah, it does. And I mean, that relates primarily to the fact that, we feel, and I think the feedback from others has been that it's important that somebody actually sit down with the patient and give them that diagnosis and be able to answer their questions.
But there may be other people who.
There may be others who would prefer to have it your way, but yeah, I mean, at the moment, yes, it forces them to do it that way. Yeah.
You're also able to see the care team for the patient, so same as what's on the patient side as well. Same pathway that's available on the patient's portal. Sorry, this one's not as fancy as the patient's portal right now. They're just transitioning between the different pathways, but it's the same information. And so any provider that has any questions about what is the next test for this patient, you know, that's often, like in primary care, they may only see 1 or 2 possible lung cancer patients a year, and they just want to be sure that they're following the right pathway of care. They're able to check here and see that. And any status notifications as well for the patients, so any upcoming appointments that they may have as well, and where things have been up, when things were last updated. What's on the provider's portal, I guess I should say, that's not on the patient's portal, the one major feature is the ability to build reports. And this is because they want to build reports on all the patients that are being seen in the diagnostic assessment program. So the patient wouldn't need a report on just themselves, but they can build a report and see all the different patients that are being seen, and they can build a report based on number of referral for diagnosis or inappropriate referrals, how many of those are getting, you know, how many, who are the providers who are referring the most to the DAP, you know, the appointment details, the procedures, and so forth. These are all reports that the DAPs themselves have requested to be built into the tool so that they're able to manage their information a little bit better. And another little nifty feature within the tool is that we're able to check off here and see all the patients with no appointments scheduled. One of the biggest challenges and worries that the DAP staff have is that they don't want to lose any of the patients and, you know, have them floating in the system without any appointments or anything coming up for them. And so through this, they're able to check this off and see all the patients who don't have an appointment coming up or that's associated with them, and they can just mentally go through, oh, that's right, it's because we're waiting for this result before we schedule this next appointment, and so forth. And oh, you know, this one, oh, there actually should have been a CT for that one. Let me go in and book that now. So that's just a quick overview of the the provider's portal. I'll pass it on to Judy, who's going to wrap up.
So I will be very brief. I think we've really pretty much covered. No, what am I doing? What am I doing? This is just some of the some quotes from people who have been using the system. A daughter, somebody who is leading the implementation in Waterloo Wellington, and one of the secretaries also in Waterloo Wellington. So get that off. There we go. So just, you know, physicians being excited about the test notification feature, and the comment from a daughter who liked it because she was remote from her mother. Key features, I think I won't go through this because I think that Melissa's done a good job of walking us through the tool. So just in terms of the future, you know, I do want to emphasize this is a work in progress for sure. And there are lots of things that we want to do with this tool. We're working with Canada Health Infoway to build the next phase 2 version, as well as with the Canadian Cancer Society, and obviously with our pilot sites. So, and I mean, I think the other thing that's exciting about the tool is obviously we'll be able to use it for other cancer disease sites, and the next ones we have in the pipeline are prostate, gynae cancers, and breast, and then, as I mentioned at the beginning, to develop the DAP EPS for the survivorship phase of the cancer journey. And I think, you know, there's also the possibility that this could be used for other, you know, beyond cancer. I mean, it could be used for heart disease and diabetes and all kinds of things. So it really has, from our perspective, it has some really exciting potential. We need to continue to build it. Those links with other databases and other patient portals, I think those things are really key, and those are the things that we need to do next to make it better, to make it more user-friendly. We will be working to make it look a little bit nicer for patients, because there's a lot of text in it at the moment, and so it's a work in progress, but we're very excited about it.